healthcare system finding it difficult to accommodate COVID-19 patients. Good morning, everyone. I'm LaDawn Davis, and this is the Morning Edition. And as always, it's great to have you in our company. Prime Minister, the Most Honorable Dr. Hubert Minnis, acknowledged that the Princess Margaret Hospital is seeing a dramatic increase in the use of health services by more critically ill patients as well as social cases. He says these factors prompted government to make sizable non-budgeted financial investments to utilize privately owned facilities to mitigate the spread of COVID-19. Here's Altaviz Munnings.
The Prime Minister painted the grim picture of the Princess Margaret Hospital's bed capacity. With 430 inpatient beds, an exponential growth in healthcare costs, strengthening infection prevention and control practices, coupled with adhering to social distancing requirements, were the common denominators that led to a reduction in the hospital's overall bed complement. He referenced 33 elderly patients who are now permanently staying at the hospital as boarders and cost $491 per day or $6 million per year. He said many of these patients have comorbidities that make them vulnerable to viral infections. He maintains they should not be in proximity to high-trafficked areas frequented by those with communicable diseases. As the Princess Margaret Hospital approaches capacity and bed availability, the Prime Minister indicated that a Public Hospitals Authority assessment team will seek alternate accommodations to relocate those boarders, with final recommendations from the Ministries of Health and Social Services. And given the exponential increase in confirmed cases of COVID-19 requiring intervention, Superclub's Breezes Resort in Cable Beach will house a new national COVID-19 response facility.
The plan is to utilize the east building of the hotel as a national response facility to meet the needs of non-COVID-19 low medical care patients during this pandemic. And this facility will accommodate both employees that are attending the patients on one floor and clinical and management operations on other floors. Security services will be provided by the Royal Bahamas Defense Force, supplemented by the Public Hospital Authority contracted security firm. This facility will be up and running very shortly.
Government will only cover utility costs while the National Response Facility is operational. The hospital's relocation of boarders and the establishment of the off-site National Response Facility is expected to make more beds available to accommodate COVID-19 patients at the hospital.
Doctors Hospital West is also increasing its bed capacity to help address the need. The combined strategy to increase bed capacity in the public and private healthcare systems will result in an increase of approximately 80 patient beds at this time. On Grand Bahama, the Cancer Society building was retrofitted to house infectious disease, those type of patients, including COVID-19 patients. In addition, a new unit is being constructed on the Rand Memorial Hospital facility. As it relates to Grand Bahama and all other family islands, if the need arises, individuals will continue to be airlifted to New Providence, where the increased capacity has been prepared for the care of such patients.
Meanwhile, the South Beach Clinic will be used to address mild to moderate COVID-19 cases, and the Princess Margaret Hospital and Doctors Hospital West will treat moderate to severe cases. And add to that, a new contact tracing center at the Melia Nassau Beach All-Inclusive Resort.
This center will strengthen the surveillance unit's ability to identify new cases and contacts, and to intervene with the appropriate measures. Health officials anticipate an increase in the number of new cases over a short period of time. A decrease in new cases is anticipated once all new cases and contacts have been identified. It is important that members of the public cooperate fully and honestly if they are contacted by the surveillance unit. your responsible behavior can help reduce the spread of COVID-19 in the Bahamas.
Altavi's Munnings, ZNS Network News.